Oh, thank you, Carlos. My name is Beatriz. I'm the quality manager for our clinical engineering team at UHealth. I've been in quality for healthcare for over 10 years, but I've been in biomed for just 2 of those years. So the biomed was new to me 2 years ago, and this was a huge feat for not just myself, but our entire department. But we're looking forward to sharing with you how we did it. I don't project quite like Carlos. I'm a little monotone, so I'll try to be as interesting as possible.
It's just a bit humble, whatever, our journey that we're about to go over here is basically our journey into ISO 13485 certification. And it's single-handedly, we got across the finish line because of Beatriz. Don't let her fool you. She's the main reason why there was a few in-house HTM organizations that is ISO 13485. So what is ISO 13485? Okay, so the International Organization for Standardization is one of the many standards that they have. They have over 25,000 standards. One of those standards is 1345. 1345 deals specifically with the procurement or manufacturing of medical devices. Not the procurement, but the manufacturing of medical devices. Okay? So it defines the requirements needed consistently and ensures safety and effectiveness of medical devices and manages risk throughout the entire life cycle of those devices. Okay? So basically what 1345 will provide you is a basic framework for you guys to be able to perform your HTM function, okay? The same across the board, right? Not different. Technicians doing everything different, but the same across the board. And they'll provide that basic framework. Some of you guys, anybody heard of ISO 9001? Anybody, any organization ISO 9001 certified? Not yet? Okay, so yeah, so ISO 9001 is something that's within the HTM community is heard of a lot more than 1345. 9001 is a more general certification. It deals with the general quality management of an industry. It's a lot more flexible and its documentation requirements. Okay, it's very broad. The 9001 is very broad. Okay, it's a standard that can be applied to any industry. Any industry, not specific. Where 1345 is specific to medical device and the quality of those devices. Okay. Device safety and regulatory compliance within the documentation. The documentation is very structured on what's required, what you have to have on hand to show to audit. And it's what we do, right? It's medical equipment, so it's highly relevant within the HTM. What are you going to do? Highly relevant. Well, why does it matter? We kind of went over that, right? So basically, even though it was written for manufacturers, it's an in-house program. Okay, it standardizes maintenance procedures and strengthens risk-based decision making. We didn't know we needed it until we did it, right? When Beatriz came on board, we started to our executive director started to venture in that space, whether ISO 1345 would be a good fit. When we started going down to the rabbit hole of our documentation and technician, that's a whole other presentation itself. Just like many of you guys, okay, we're pretty confident in that the work was being done. We're like the University of Miami firefighting team. Any problem that came up, our technicians are good. Always goes well. Run up there, put out any fire that you want, fix anything or whatever, go back, have a beer, have a cigarette, go back, and basically pat themselves on the back. I saved the life today. They totally forgot what the document, what system to put it in, or whatever. So we started doing some audits. And the gap was that, the work was being done. We couldn't I also went into the quality of the documentation that was being provided by our technician. You got the guy that tells you he got a cup of coffee this morning, right? Ran into his old girlfriend, everything is listed. And then you got another person that says, PM complete. Then you got the other person that just looks out the work order and says, man, I did a great job. So there was no standardization across the board. There was no standardization across the board. ISO 1345 solved that problem before. The thing about ISO certification, it's not about perfection. Okay? It's about continuous improvement. We'll never be perfect. We're always going to have that guy that has a cup of coffee. Somebody's always going to be PM complete. It's all about the continuous improvement of your program.
So you've decided you're going to pursue 1345. I recommend you think about these two next slides before you do that. Do you need a consultant? So full disclosure, we did get a consultant, and there are some pros and cons to this. As Carlos mentioned, not many in-house HTM teams have pursued this. The standard was written with manufacturers in mind. So a consultant has probably worked with 1,000 manufacturers in order to help them achieve this, and you're be the sole HTM program that they have worked with. So they're kind of learning it along with you. That doesn't mean that they don't provide a framework and help speed things along and keep you on track, but keep that in mind. Some of the cons are the cost. Can your department afford this at the moment? I just want you guys to remember, nothing against our consultants, but nobody knows your program like you. You can totally do this. There's plenty of resources there for you. Now you have 2 more to be able to do this. If you are trying to crunch it down in a short amount of time, you may consider getting a consultant. But if you have time to make it happen, doing it yourself will integrate it more into your system than trying to speed things up. You know, I feel like thereafter, we actually got the certifications where no real work is being done by our department in order to keep it. And I think we could have, but especially if you have a resource like me, your own quality manager. If you don't, you may consider a consultant. So it really depends, but this is a decision that you want to make early on. Next, you want to pick an accrediting body. They only have so many auditors to send out, so they have to schedule them out. So once you make your decision, you want to pick an accrediting body. ISO doesn't come to your location. It's kind of like Joint Commission comes on behalf of CMS. You need to pick an accrediting body. You want to make sure that they are accredited and recognized organization. How we did it is we picked a local place. We figured we wouldn't have to pay for airfare, you know, save some costs that way. And we wanted to support a local business in Miami that is doing this. One thing to consider, your costs will be based on the amount of team that you have, so your cost, and as well as how many days they're going to be at your site for the audit.
All right, guys.
It's game time.
So basically what we're going to go over is I'm going to give you guys an outline of what we did to get to 1345. That's going to cover CMS documentation, QMS documentation, all the records and evidence that are required, right? Like your maintenance log, CMS, frequent supplier list, and then any supporting documentation. You need to be able to show, you say you do it, you need to be able to prove it. Right? It's not documented, it's good. Okay? So keep in mind, what we're going to show you the work for all organizations, ISO 1345, or any certification for that matter, is not one size fits all. So what you'll see here is what we went through, right? It should provide a good basis for anybody that's looking to pursue that for their organization. But, you know, yours might be completely different. So just keep that in mind. Okay? First and foremost, you got to define your scope. What do you do? Right? What services do you provide? All right, so you might immediately think I'm going to go to ChatGPT and I'm going to get this 3-page document and tell me my scope. That's what but no, it doesn't have to be super elaborate. You're very general in nature to cover the entire scope of what your department is doing, right? Because as we go through the documentation process, we're going to outline specific processes for specific things that we do within the organization. But the scope is going to be a lot more general in nature. Okay, and this is our scope. Maintenance, repair, calibration, and life cycle support of medical equipment. And then you're going to identify any exclusions. Remember, 1345 is built for manufacturing of medical devices, not necessarily repair. So within that standard, there might be a lot of standards that you don't need. Right? It's important. We don't manufacture medical equipment. Repair and maintain, at least at the University of Miami. You guys are doing some impressive things. We don't manufacture. So that's one that we exclude. And then you have non-applicable clause. Okay, non-applicable is not the same as exclusion, right? So you might have a practice that's being performed in your organization, the sterilization of medical equipment. Does that happen in your organization? Okay, but you guys, within HTM, within CE, or whatever you go about it, you guys don't do it right, but it's still happening within the organization. So now that practice is not applicable to CE, but it's still not exclusion because it happens within the organization. So just keep that in mind, okay? And then when you see here, you'll see a list of different exclusions with the justification, right? You just can't say, no, we're going to do that. Right? You have to be able to justify why you do that. What is that process behind it? Right? For sterilization, right? That lies with our STD form. So we don't do it. So we have to be able to prove it and show where it exists. So design and develop, that's an exclusion. Down to sterilization or implantable devices. They're there in the hospital, implantable devices, but we don't make that. So that stuff would be not applicable. Then going to clause 2, which is our references, government references, right? And what government references are referred to is basically the governing bodies, right? That dictate how you operate. The Joint Commission, the DMV, who else? It might be something local or state, right? In Florida, we have Congress, okay, that basically governs. There's another governing body that we have. Yeah. Whatever it is, it has to be listed here. Okay. And then the terms and definitions, that should only be 3 for 1345, right? The terms and definitions are already outlined for you. So you pull that out of the standard, you list it under your clause 3, and you're off the run, right? You're already done with the clause already. See how you hear that in?
MS, the quality management system. So now we're gonna prove that we're doing what we say we're doing. Next slide. Your Bible is your quality manual. Everything needs to stem from the quality manual. When your auditor comes, the quality manual is gonna be open the entire time. From there, you're gonna go to all your documents, to all your proof. So you wanna make sure that you have a quality manual. Number 2 is your process plans. You're going to decide what your key processes are and make sure that all your operations in your HTM program fall within one of those key processes, and you're going to create plans for it. We're going to dig into that a little deeper in a minute. Document control, any changes you're making to your documents, you need to make sure that you have that documented. Records management, we need a place to keep all this stuff. Supplier controls, we got to make sure that we are evaluating all our suppliers, all our third-party vendors that we're working with, and change management, a formal way to document any changes we're making to our quality management system. If I were to start my quality manual all over again, this is what I would do. I would get the clauses and the standards from ISO 13485, copy and paste it on a Word document. And I would go one by one. Does my team do this? Yes or no? You may not have the answer. It may be a bigger discussion with your team. Go clause by clause. Do I do it? No. If I don't do it, it's an exclusion. Can I prove that this is an exclusion? And move on to the next one. Do I do this? Yes. And the answer is yes. Do I have the documentation to prove that I do this? And this is what's going to guide you throughout your whole way. If I were doing it from scratch, if I didn't have a consultant, that's exactly how I would get this started.
All right, so we're going to move to the process plan. So as Beatriz mentioned, right, you are required to develop specific process plan for your QMS, quality management system. Okay. Again, it doesn't have to be all encompassing, right? We have 1,000 processes that we do. Okay. We develop 4 key process plans. Right. So everything that we do within clinical engineering falls under one of these 4 key process plans. Yours may be different. Yours may be different, but ours fall under them. Okay, so it's very important. Make sure you identify the key process plan and you tie individual processes to one of those plans as you go along. All right. So we got quality management, customer support, service delivery, and purchasing and receiving. So when you identify these key processes, you're going to have to outline basically the basics of those processes. You have to, what's the name? What are the associated documents within that process? So our example here is purchasing and receiving. We do all our purchasing through Workday, right? So all the POs, Workday, all the requisitions that are submitted, right? Any type of supplier requests or quotes, all those items that fall under documentation. Quality objective. Sorry, but
Only because purchasing, we work with the VA,
Yeah.
yes, but there's so many other variables to just getting the PO and getting the product.
absolutely.
So with having other departments that have, we have a vested interest in them supporting us. How do you incorporate that into your land process plans? And most importantly, if their process is jacked up, how do you get around that to kind of mitigate?
So we're actually.
We have a slide just for you coming up.
That's a great question, and we actually, we'll talk about that here shortly, but you are required within the standard to basically not only talk about yourself, but what you do, but the process that anybody can collaborate with within the organization. Okay, and you're 100% correct, right? We don't call it the process, but your slide is coming. When we talk about objectives, okay, you have to, objectives equals KPI. Objective equals KPI. So when you identify an objective, which is receiving parts, how do we measure success? Right? When it came to parts, we measured the return rate. Right? How many items we were actually returning to the product. That was our KPI for this specific process.
Can you expand? I didn't understand. What do you mean you were returning to this?
So we ordered 10 batteries, right? And the batteries arrived on site for these vital signs monitors. And when we installed them, 2 of the batteries don't work.
Oh, you returning it
So
back?
we return it back to the manufacturer.
Not the equipment.
Not the equipment itself. Not the equipment, it could be the equipment itself, right? If we're ordering a whole device, right? But basically the KPI is anything we have to send back to whatever vendor we purchase. Right? And that doesn't only apply to parts, it applies to service. Right? Somebody comes out to perform service, tomorrow you get the same call, right? They didn't fix the problem. So you have to identify that and track.
What you want to think about here is if this process plan is about purchasing and receiving, how are we tracking and monitoring with data that we're being successful at this plan? You know, and we decided that's one of the things that we wanted to track to measure success.
Is that, you order the part, the assumption is you get the part number right, pricing right, delivery just in time. So there's one component.
Right.
Mhm.
And then the vendor on the other side, the receiver gets the price, the part, et cetera, and then you look up to the obligation. And then you get the box and the shop and you go, it's screwed up. So with your QA process, you're able to go back and now.
We can investigate each return, yes.
We'd be able to investigate each return, right? And that this standard allows us to do that. Now we track it.
Lay it out all the way.
Exactly. Key reasons where do you order the parts? We order our parts for Workday, and see parts or something there. There are many third-party vendors. That's what we utilize for the majority of them. Okay. And then anything that's outsourced, right? So we're talking about outsourced process procedure. That's external and internal. External and what is outsourced outside of CE, outside of the HTM? All right.
So all of those peripherals and support, when you go out and get them to be part of your team, as you're trying to get this certification, what if they're not cooperative? What if you hit any barriers where you're becoming involved with this?
Right. So the standard itself is specific for the HTM department. Right? So the person is the department that's being accredited is clinical engineer. Right. So any process or procedure that doesn't work, right, or is not best outside of our internal processes doesn't affect the certification itself because the department is the one that's being certified.
So you're able to achieve, in spite of perhaps peripheral.
Exactly.
Absolutely.
Exactly.
And then the light goes back on them.
Exactly. 100%.
So we've been asked to certify since 2021. We're in the process of redesigning a very global. Serious.
Mhm.
But to answer your question, is so our corporate is 9,001 certified. We're in-house subservient to them, and there are lots of other departments. And in our quality manual, it puts the standard process as outside our department. We reference that. So for example, Workday, just say we follow the important policies and we reference it. So if the auditors come, we can go to policy medical and they can see it. And they know, they usually don't, because as long as if it's outside the box, you can point to where it is.
And that's
Yes.
good, right? So we point it in that direction. We say this process ends here with us, and then from here, we go to this department, and they have their own options and procedures of how they do it. Right? And then that's a good time back to 9001. More general in nature, right? The overall, how we perform business, and then 1345 goes specific to those medical devices. All right? Each process requires an audit. Somebody has to own the process. Luckily for me, I get to look at all the POs and stuff, right, the director of. But that's what me, like the gentleman mentioned, who touches the process, right? Our technicians are ordering the parts. Our sources sending us the parts. Supply, the loading dock received. So you have to have all those items listed down here, who is also within the process itself. Okay, we're back to our KPI, right? Return rate. Right here, all the additional clauses that this process also interacts with within the quality management. All right, then any risks or opportunities. Okay.
Document control. So you want to make sure, like I mentioned before, that any changes that you're making to your document, you have those changes documented somewhere. So you want to make sure you have version control. The first time you do your quality manual, that's your version 1. For us, the approvers are myself and our executive director, Anthony McCabe. Some of you may know him. We're the ones that approve all the documents, and they get implemented after our approval. That's when I go educate the staff on it, assign it to them for review. And you want to we have a general organizational location for documents like this, but they're publicized to everyone. Since these are internal, this is the way that we're doing it now via SharePoint. I keep all of the stuff in a folder. You could do the same. It could be something very simple, just like this. You put all the changes that happen between version 1 and 2 under change control. You get that approved and you're good. So something as simple as this can prove your change control process. We're hoping in the future to have a place to house it that'll be stamped, electronically and automation, but it doesn't need to be fancy. You may not have the resources and still be able to get this done. That's what I wanted to show you guys here. So you can't control documents you don't have. So I recommend the less places you have things, the better. So we're dealing with fires, like Carlos said, putting out fires all the time. We were doing the work, but we didn't have anywhere where we were tracking this stuff, making sure we get it done. How many times have you guys talked about something at the managers meeting this week, and next week it comes up again, nothing was done from last week, so you want somewhere where you can keep that stuff. You want somewhere where you could keep that stuff. So ISO does require you to document your non-conformances, your corrective actions, any changes to the QMS, your evaluations of the suppliers. We decided to house all of that in one place. And that way the entire team is trained on just one thing and they can be a part of the process as well. So my team members can send me this form via Smartsheet of a non-conformance that they want leadership to take a look at. I made sure to the information that I need in order to move this forward to make it mandatory field. So they can't send me this form unless they give me the bare minimum that I need. Next slide. These forms turn into this. So this is what I bring to my managers meetings now. So I have all the non-conformances we're dealing with, all the things we're tracking, where in the process we are with that non-conformance, and we have an opportunity to have it there for us to look at and go over and make sure nothing gets put in the, like, not looked at for a long period of time again. Change management, any modifications. Sometimes changes come beyond our control. The organization makes a decision. We got to move forward with that decision. It's not necessarily a non-conformance. It's not necessarily a complaint. The change didn't stem from a problem. It could just be an improvement. Regulatory changes can happen, So you want to also control those changes, make sure you're documenting those changes, because what ISO wants to see is any changes made to the quality management system from when you implemented it to now, you're tracking all of that stuff. You're making sure that those changes are working for your team, not affecting them in a negative way. So you want a place to house that as well. I went with Smartsheet for that too.
You mentioned changes. Are you, when you're talking about the KPIs, are you creating benchmarks in your initial version?
Yes.
And then reevaluation?
Yes.
What do you, it sounds like that, but your first iteration, are you swagging it? So you don't.
So I do, I do research. Also, we were doing things prior, like I've been rounding for a long time. One of our objectives is rounding and our compliance rate. I got my team up to like 97% joint commission time, but we didn't round for a while when I was working on this. So I made 95 our first goal. If we go under that goal in whatever way, that turns into the non-conformance, which turns into the CAPA, and so on and so forth. So I also look at the market, like how's everybody else doing? ChatGPT is your best friend as well, can tell you what's going on out there, and that can be your first threshold. And they can't tell you what you want to do, you know. But if this year they come audit you and you were 100% on something, and your goal is 95, and the next year you're like at 87, that's when that's gonna trigger them. So don't shoot yourself in the foot, but I'm ambitious too. Like I don't put easy thresholds either.
So you got API benchmark,
Hmm.
and then I saw it on your written notes, like, you track incoming inspection.
Hmm.
Right, so everything coming in, obviously should be inspected, that's a no-brainer, that's 100%
Yes.
compliance, right? But I would assume when you're looking at that, maybe you got some minutia of, did they get the manuals, did they do the proper stickers and
Hmm.
asset tags and things, like you got subcategories of incoming inspection.
Hmm.
So,
So we track those trends within that one objective. So when I round, I can see whether the biggest problem we're having is expired PM stickers and figure out there, how am I gonna educate the team on that? Let them know what's going on. This is what's bringing the number down. Mhm.
And we document all that, so her team actually performs weekly audits at different sites every single week. And we audit those devices, anything we find, we create a new work order, has to be corrected, there needs to change documentation on the trace ability. So also, our leadership teams are required to do a certain amount of auditing and work orders within their reports. Right, and any information that they find on a particular work order, whether they didn't attach to a test equipment that's required. And that's a finding right there, and you basically report on themselves. Another thing I wanted to mention, I believe that your head comes up, that you talked about benchmarks, right? Utilize your partners too. So partners have their own internal benchmark of what they're doing. It's okay to utilize your partner. Say, okay, we're going to use that one, we're going to up it a little bit, right? Because it's the start of the program. Instead of just trying to pull numbers out of the air.
that's correct.
Right.
Yeah, I was just wondering about the onboarding, like if it doesn't go through biomed and somehow goes to the floor instead of through biomed, just catch that and then you have to come up with an action plan or something.
Right, so her quality round will catch those events, right? The good thing about the numbers for initial inspection is she finds it, right? It's a finding, but on the work order itself, we're 100%. Now we have identified it, now we just do the,
Okay.
we don't necessarily go back and track it. Right? We found it now.
If it was something that was happening all the time, I would dig probably deeper there and see it. Start fighting with supply chain, like, what's going on here?
So the standard here requires you to have supplier control. Right? For anybody outside the organization that's providing you with equipment or parts, whatever, you need to basically have control of the supplier. Okay? You're making like us. We deal with thousands upon thousands of suppliers. Okay? The standard doesn't require you to have documentation on each supplier that you work with. Right? So it basically gives you the freedom to kind of identify who are your key suppliers. Right? So taking that, we identified our key suppliers, anybody that has active service agreement with them, okay? Or any partner that we basically deal with constantly on almost a daily basis, hard source being exempt. So these key suppliers, the standard requires you to do essentially like an evaluation on each supplier. So our leadership, we kind of split those between our leaders, and we did individual supplier, right? We sent the imaging ones to the imaging team. Any big contracts I dealt with, supervisor managers did, I just said they were doing services. Now, I do want to reiterate or make sure, don't do this in the back, right? You need to talk to your peers, because the experiences that I have with our source might not be Beatrice's experience. We need to capture all of them. We need to capture all of it on those evaluations to make sure that we are good to go. But one of the biggest points that we identified on this was with the contract. I think we had active service agreement. Then go through process project collaboration, right? So contract. We don't handle the contract in-house, okay? Well, in our department. We, the users send us items they want under contract. We do, analysis and return on investment, all this type of stuff. And then we send it over to contract. It's an external partner. We got multiple external partners. Right? Then it requires you to identify those external partners. Okay, and then basically identify where the process stops with you, where it picks up with somebody else. Right? So as long as your portion is documented and you're able to point in the direction of once we submit the contract, talk to these people, and it's documented within our QMS, we're good.
You can literally have bad actors within the curriculum, but as long as you're that counts.
That is correct.
My advice, so I bleed orange and green. However, not everybody's perfect, so my advice would be get with these teams for sure. Find out about the process. They may not have SOPs that you can cite. They may not have things going on. Fortunately, that's beyond our control. I would say be comfortable enough explaining the process to an auditor and have a contact at each of these departments that can speak to it. No, hey, I have an auditor coming this day to this day. Can you tell me someone in your team that could be available to speak to this process just in case? I think we had one scenario during the audit of that where they wanted to learn a little bit more.
Beatriz was really good within our QMS, right? Our SOPs and documents, kind of highlighted this department and SOP. We have a link within our SOP that sends them
To those, yeah. For example, if there's PHI, IT steps in our site in order to make sure that those hard drives are cleared prior to a device getting removed from the establishment. So that's part of the end of our care of that device. So that needed to be,
No, they're
IT. Quality is not just my job, it's everybody's job. I am here to facilitate. So one of the main things was getting my leaders to buy in. They're the best, I really can't complain. We have a very tight-knit team who was excited about this and was a part of it with me from the beginning. So some of the things you have to do before your auditor gets here, how you can prove that you have that leadership and ownership of the QMS, is you're gonna have management review meetings. You could choose the frequency that you want. The standard doesn't tell you what you need to do. I made it quarterly or as needed. So bare minimum quarterly, we're going over these documents. We're going over all this stuff that we say that we're doing. In the last 2 quarters, we've had 4. So we've had about 2 per quarter, just FYI. Another thing that needs to happen before your audit, your official audit, is that you're gonna have an internal audit. The consultant, if you decide to go that route, try to get that in there for them to do it for you. But if not, there's plenty of resources available. Maybe even your accrediting body can help you out with that. I don't know if I would want the people coming already to do it. I would want other eyes, but it's up to you. So you do have to have one of those before. They're gonna have non-conformances. Have them solved before your stage 1, okay? Make sure you solve that stuff or you're working on it and have proof of it. Quality policy. This is ours, not necessarily yours. But you want your team to know where to find this. They may ask a tech, what is your quality policy? They don't need to recite it. They don't need to memorize it. I would say train them on it, make sure they know a little bit of what you put on there, or at the bare minimum, know where to find it. Here's my advice. Don't put anything in there you're not doing, because they may go word by word. How are you innovative? How are you providing, so stick to it, make sure you're actually doing it, make sure your team is aware of it, knows where to find it, and what you define this to be. A couple other documents, we touched on this quite a bit already, but measurement plan, that's where all your objectives, KPIs are, the thresholds you put, you're gonna have a document with all of that and tying it into those process plans, those key processes that you defined. Another thing you'll have is an improvement plan. This is an opportunity, whether you feel like you're just at that put fires out stage, Doesn't mean we can't get together and come up with worst case scenarios. Like, what if we lose our certification? What do we do about that? What's the impact that's gonna have on us? Have those discussions. We decided to score it. That way we can prioritize in those meetings as these things come up, which ones we wanna start working towards and being proactive about, being preventative about. Our team, they're the best. Oh, I missed them. So your QMS is only as strong as the resources supporting it. You want to make sure that your team is competent. You know, we have all this expectations of our team. What are we doing for them to make sure that they can do what they need to do? That's where clause 6 comes in. We decided to implement a training platform. We didn't feel like the organizations really had everything we wanted in order to have all our training, all our proof, all our content, all our certifications in one place to show that competency. It's a great place for them too, to have when they do the evaluations, they have all their stuff in there. They can print out, pull up for their leader. So we also have a place where we store our policies. I can assign acknowledgements to the team, make sure they're going in there, reading these policies as the different versions come out. Have a training plan. This were the bare minimum things I knew I needed proof of before the auditor came. I wanted proof that I trained them on ISO, on all of our SOPs, on any organizational SOPs that they should be aware of, any quality objectives. What are we measuring, guys? What are we working towards? Procedures, our CMMS, that there was a training documented that they are trained on our CMMS and also our departmental SOPs.
You get in the hot seat and you have to take the text, and engineers have to adhere to, I have to keep that efficient, which means that's time on the clock to go over the policies and procedures, et cetera. Yesterday, he had HTM 101, having quarterly meetings, monthly meetings. How do you apportion the time up to them, keep current with this, and then do their job? And then the last part was the efficiency piece of, you know, getting somebody sent to it, et cetera. Is that incorporated into this piece as well?
We definitely had the proof stored in the same place. However, your auditor is just gonna go over these specific trainings. He may ask you if he's looking at an imaging person working on something very specific that he should be OEM trained on. Maybe he'll ask you for those credentials, and we do have some techs trained on that, but. Yeah.
But he may not have gone to the latest OEC school. Do they get into that training?
No.
Not for the audit itself, but again, if you take it for an audit, right, if you go through and you show him put the PM on the OEC 9900, he might ask, oh, is it required to have vendor training? Oh, do you have the OEC certificate? He may ask that, but from a broad, like overall view, that's not the requirement. When you go back to your documentation for time, we do the same thing as we were doing, of course, with the general. Our right now is about 75% productivity across the board. Turn the range 75% of the time, and then we do everything else that happens in that stuff. All right, clause 6 also governs, the infrastructure, the area where your technicians are working. It's kind of hard to say you have a big medical equipment, you have a quality management system, if you have no test equipment to do it. Right? So all that stuff needs to be documented to include the area. When the auditor comes, he's going to look at the workspace, the clean, the safe, and have either EMAX, they're working on a specific requirement. And any changes in that environment need to be also to do your CMMS. That's part of the work environment. CMMS, so any type of upgrade to your CMMS, to your bolos, or whatever you're using, need to be documented. Beforehand, what were the changes? How did it change the environment? So see, it's very important, okay, that you that all those things are documented. All right, now we're going to clause 7, which is product realization. Okay, I know I talked about exclusions before, right? So you might think product realization, we don't realize any products. Right? Okay, Clause 7, you cannot exclude. You cannot exclude. The standard is designed for product manufacturing. So you can't exclude clause number 7. Okay? What we did was we redefined it for our organization. So we don't do product realization. What we do is service. It has to do with all our practices and procedures, right? All our general maintenance, parts, anything you can think of, doing all our work instructions, SOPs, all that stuff we're talking about before. Can't exclude service realization.
Exactly.
You're providing a service. All right, and these are some of the different definitions that we have under 7.5. Control of service provision. And our definition is plan, preventive maintenance schedule, and calibration procedure.
Good news about 7.5. You're probably done here, hopefully. Hopefully you have your PM schedules, hopefully you have your work orders, hopefully you have all this stuff. We just have to make sure you can point to it. You're already doing it.
But remember, okay, once you say you do it, you have to be able to do all these things with that particular practice. Let's say you perform schedule maintenance. How do you control schedule maintenance? How do you utilize the tools given to you? The equipment manual. How do we validate those are being completed? Closing out the work order with CFS, somebody doing, and so on. How do we track? What's our traceability? How do we show success? And has it been reviewed in our quarterly meetings, our weekly management meetings? All that stuff has to be done. Like you said, fine. Say you do it. Sure, it's written down. This also applies to your test equipment. Believe it or not, this was a big portion of the actual on-site audit. Every work order, the guy sat down, the auditor sat down with our technician. Said, all right, open up a work order. Go ahead, do watch the technician, do the PM, right? And every single one, which was multiple, he wanted to see the documentation of the test equipment that was being utilized. This is also a big item that's being seen right now in trend across Joint Commission and D&D services. Right? The traceability of that equipment has to be tested. You're not doing it in-house. Who you send it out to? We have the service records. Where's the document? Okay. Is it in the work order, like you had mentioned, right? So we have to list all our test equipment in the work order. And another thing that we didn't know at the time, some of your service providers for test equipment might write in there before calibration, piece of equipment good to go. That is not okay. If you have a piece of analyzer that has 100 parameters, with different points of testing, every single one needs to be listed on that document. Every single one, not high, medium, low, not PM complete. Every single thing that piece of test equipment can do needs to be listed on that test equipment service. That's the only finding that we had. Not because our provider didn't provide it.
So, you know, you said the goal. I mean, we're using a different system. We have goals. When you pull down a test equipment, put it into the work order, that's sort of pre-built. I'm assuming you want to.
We do it that way.
Yeah.
You keep the due dates of the test equipment.
Yeah.
So
We inventory the test equipment just like our medical equipment.
We have to put the control number that analyzes in the work. And then it pulls up. Yes, it will. It populates the data right there. So we put the control number, data populates, the technician can see whether it's applied or not. And that's a required field, readiness.
Piggyback on that. So what you have, well, we use ball as well, or currently when we bring up our testing, we have to put in the actual calibration date, most recent calibration date.
So we don't put it today because remember, we track our test equipment in the vote. So it's already in there. So when we put the control number, we have an automatic field that populates the.
So this is what we got. We went the easy route. Yeah, that number contains to get the field service report. So it's traceability. We don't put that we don't lose the information in the work order. We just put TP colon and then the access number right to the field.
And hold that for. That function does exist.
My advice is, what you want to make sure here is that you are tracking what tools are being used for each work order. Because if something comes out of calibration, whenever you do send it out to the vendors, you want to be able to go back to the equipment that that device was used on, or at least a substantial sample of it, to prove that everything's okay with that equipment that it was used on. Clause H is kind of a conclusion of everything. So in your quality manual, here's where you would put, how are we measuring all this stuff? Now with all this information we have, all the CAPAs, all the documentation, all the improvement plan efforts, what data is that giving you? What improvements are you gonna make now that you have all of this for you? So this is kind of like a conclusion slash starting all over again. So that's why I put that wheel for you. So we're at clause A and then just circles back around. So.
It's time to get audit proof.
How do we get our team ready? This is the good stuff. So sorry, we're getting a little close to time here. Our team, if you take anything from me today, involve them from day one. My technicians, my leaders, everybody, imaging, biomed, I had everybody helping me with everything. I made them review the SOPs for me. Is this what you guys are actually doing? They will buy in, they will get into it. If it's like, speak now or forever hold your peace, if it's on the SOP, that's what you gotta do. Trust me, they're gonna get involved. We're very lucky, but you wanna, from the beginning, start preparing them, because maybe some of them have never been through an audit before. You know, when Joint Commission comes around, maybe they'll talk to us, maybe they'll find something. Mostly they're gonna ask leadership for sterilization records, things like that, depending how big your organization is and how much stuff they're looking at. Not that they don't matter, but this is 3, 4, 5 days of them looking just at you. Now, them talking just to your technicians, they may have never been through something like that. So you want to keep them in it every step of the way. That's going to build their confidence throughout.
One of the biggest things that we did, and you'll see it here, right there in the middle, we provided them with an audit pack. Each technician received an audit tip pack. Once again, there's no requirement to memorize all this information. The quality policy, who on earth is going to remember those 5 sentences? I don't know. In my NCO back in the day, would have made me memorize it, but it's not a requirement. So we built these packets for them that they could reference, not only during the audit, but reference period. Okay? Along with training, and then like Beatriz I mentioned, they were the key members in all our SOP committee meetings. They're the ones that do the work, right? They're the ones that do the work, so you need to have them involved also. Here's an example of some of the workflows that we created that were really looked at. Remember, normal business, okay? So incoming inspection shows the whole process. What this also does is standardizes the process across the board. Nobody understands what the next step is. Okay? Another one for ITM.
So I told them, I'm going to come out and pretend I'm the auditor, and I'm going to watch you do this. I don't know anything about biomed, but I know that these things have to happen for that work order. So if I come watch you do a corrective, this is what I'm looking for, that you're doing these things. I don't know how to do a PUM, I don't know, but I need to know that you can do these things. So I created these, this is what has to happen, this is what needs to be standardized across the board. I involved them in creating these too. I had them look at this before we finalized what it was gonna be. And I gave them packets so they can have, so I let them open book if they had to, and it gets them used to having someone watching them do their work. That's not their typical day. And I really think that it prepared them. And it also gives leadership an opportunity to be out there with our team. I cannot stress this enough. Now we do it all the time. That's where you're going to figure out what your team needs from you, what the program needs from you. It was great. And we're.
At the end of the day, it's a minimum price of admission when it comes to these items. What do you want? People do things different. We already know. But as long as they have this in front of them, they'll be able to walk and trace. Okay. These are other examples, right? We did, as mentioned, with Beatriz.
This was my first time going through ISO, but I've been through many audits before. So I gave them, the basic do's and don'ts that they may not know. If you don't know something, don't answer. Don't make anything up. Never say never, never say always. The do's and don'ts of auditing in general, I let them know. And I told them, you guys know what you're doing more than this guy or girl. that's coming to watch you. Be confident, you got this, you can do this.
And it's very important to do these, right? When we did our own internal audits of our technicians, one of our technicians did a fantastic job, right? Answered every single question. So, couldn't say anything, guys. Just so happened, I picked the same individual and he froze.
Try to say the.
Figured out, identified the question was being asked, boom, it was right on time. Very important to prepare. And then the day came.
So, yeah.
Stage one is just her. So, you're good there.
It's all document review. Stage one, the auditor's gonna decide, are you worthy of stage two, pretty much. He's gonna go skim over all the documents that we just covered and then some, and in and out, I would maybe bring a leader in to walk them through something. But pretty much I spent 2 whole days on Teams with this person, 16 hours. He deemed us worthy. Stage 2 came around. He came, there was 1 auditor and 2 observers. 1 making sure he's doing what he's supposed to be doing, and another from that accrediting body we work with. I think they were just excited. They had an HTM, business. I think we were their first, so he just wanted to come. Don't talk to my people. He could talk to my people. You can't talk to my people. So just make sure if they do bring others along, that they don't get involved, they don't talk too much. You can check them if you have to. This is the guy that can ask me for stuff, period, or talk to my team, and because you're not gonna count whatever they came up with against me. So that's why I put them on there.
There's some photos of our team that are stage 2. I think from an HTM perspective, I've been through a lot of audits, right? A lot of documentation, cap, all that stuff. Sure, you guys have to put up. This is the most invasive audit. Right? The most invasive. He could care less what we have to talk about. He's sitting down with the people that do the work.
Oh yeah, he told me stage 1, I don't want to talk to you. Stage 2, and I barely spoke. He only wanted to talk to my team.
And you can see it in practice, right? Do not try to prepare, right? Don't not have your send into Jorge. Jorge's gonna be my best. He literally walked into the shop and said, "You, what do you have going on today?" And he didn't want to see things just in the shop. He said, "Oh, do you have any work orders that take you out to the field?" "Oh, I go to the 7th floor." "Let's go." He goes to the 7th floor. And then after the office, you come down, we get Sylvia down here. He would come down, okay, so you finish with the PM, let's go downstairs, show me how you do the finishing documentation. What's your process? He didn't focus on whatever you wanted to show him. He wanted to see a high risk ITM. How do you do that? How do you perform a non-high risk? How do you do corrective? Right, so we have a corrective over here that's being corrective here. This is a high risk ITM, another high risk ITM, and then also documentation. Very invasive, right? From cradle to grave, from the beginning to the end. Funny story with this one, we went to the round, 20 minutes away from our main location, so we give them a heads up. Right? So these guys.
Hey guys, be there in 20 minutes.
You guys know what that is. You guys look at the actual procedure of that checklist. We usually have this is a nature interview of a test equipment. So that's about 200 steps.
Justin thought he was looking out for the homies. He's like, the longer this guy's with me, the less he's gonna bother the rest of my team. You know what you're doing. Yeah. Wait, before. Have a home base. Even though he's gonna spend most of his time looking at your team, you need to show that traceability, the work order in Nuvolo, where that we document it. So you want to make sure you have like a conference room set for those days where you can go and pull things up as you go along. Spoiler, we did it, guys. Now we gotta keep it. Yeah.
At the end of the day,
they did so good, and they were all more than willing and excited. Our poor, he froze, but he volunteered, so they were excited to be a part of it.
Never ceases to amaze me what our technicians.
Yeah.
Okay.
Some final tips, traceability. Just think about that the whole time. Clause by clause, trace that whole process that you're gonna prove that clause from start to finish. From the moment you get that equipment from supply chain or however your organization does it, to surplus, taking it away, took my tags off, it's getting out of here. You need to have proof of all of those steps, all that life that you had that device with you. And that's what they want to see, traceability of all your processes. Again, you know more about your program than the auditor, you know more in your program than a consultant, than anyone else. You know your product, you can do this. SOPs, QMS, all your documentation. You can always ask for clarification. You know, the auditors, and they're not always right. Maybe they find something you don't necessarily agree. That's okay. You can always ask for clarification, handle it when they send you the report. Keep your team involved from the beginning, and you got this. You really do it. Now you have us as well. We're here for you. Yeah. My supportive spouse in the back, this was his idea to put the you there, so this is his slide. We're here for you. Seriously, anything I showed you here, I'm more than willing to share with you. Oh, you don't have to give them any of your stuff, the auditor. It's not like Join where you upload it in a portal, all that. No. What you see is what you get. You don't have to send them anything on the spot. What he sees during your documentation on it, what he sees there with you those days, that's what they get, okay? Just so you know.
So when this is going on, they're in receipt, they do any best practices or